Thanks so much, Jonathan. Good afternoon, everyone. I am grateful to be able to share this exciting new initiative that Governor Kotek is leading alongside the governors of California and Washington. We are here because our communities deserve clear and transparent communication about vaccines, communication that is grounded in science, not ideology. We know that when guidance about vaccines becomes inconsistent and politicized, it undermines public trust at precisely the moment we need it most, when we have already experienced an accelerating erosion of that trust. And that is why Oregon, California, and Washington are stepping up together. Because when federal leadership falters, our people cannot be left to navigate a patchwork of politics and piecemeal pharmacy rules. Now, the Alliance is just beginning its work, but our purpose is urgent and it is united to provide clarity, stability, and science-driven guidance so every family in Oregon and across the West Coast knows how to protect themselves this winter and beyond. Our goal is to cut through confusion, to strengthen public trust, and to make sure that every person in Oregon, every family in our partner states, has the best available protection. Happy to answer questions over the 10 minutes we have today.
Thanks, Dr. Hathi. First question today comes from Lisa Balick with Point TV. Go ahead, Lisa.
Thanks, Dr. Hathi. Was talking to Dennis Worsham earlier up in Washington. Question for you relative to insurance. In other words, if somebody wants to take their child in to get a COVID shot and the recommendation from CDC is that they shouldn't get one or don't need one, how is it going to be covered for insurance if Oregon says, yes, you can get one for your child?
Thanks very much for the question. And that is precisely the type of situation that we're navigating in alignment with Washington and California over the coming weeks. Here's the problem that we're solving for. Federal decisions have stripped away transparency. They've sidelined scientific experts. The result, as your very question illustrates, is confusion, not confidence. Providers are left without clear rules of the road, while families are forced to guess whether vaccines are available, recommended, and covered by their insurance companies. And in public health, this confusion is not neutral. It is dangerous. It delays care. It fuels inequities, and it puts our most vulnerable neighbors at risk. And right now, the nation's vaccine guidance feels like a patchwork quilt, frayed, inconsistent, and with too many holes. No family should have to play detective just to find a vaccine for their child. Parents shouldn't have to scour pharmacies and websites to figure out if their child can get a flu or COVID shot. Seniors shouldn't have to choose between paying out of pocket or skipping protection altogether. Providers like myself shouldn't have to spend hours explaining shifting rules instead of caring for our patients. And when coverage rules change overnight, it's not the lobbyists in DC who pay the price. It's the grandmother in Pendleton, it's the nurse in Klamath Falls, and it's the grocery clerk in Portland. So this alliance is about protecting people, not politics. It's about making sure every person from the coast to the Cascades knows where to turn for care. And it is precisely those questions within the differential bounds of our respective states, statutory and other administrative authorities. It's those very questions that we're looking to unravel and provide clear guidance on over the coming weeks and months.
Can you answer the question? What will happen when it comes to insurance coverage?
Our goal is to ensure continued access to vaccines with no out-of-pocket costs to consumers in Oregon. And so again, there are various levers that we are actively exploring alongside our partners to ensure that, but that is the principle at the base of the alliance.
But right now, there's no guarantee that it would be covered under state insurance guidelines. Is that correct?
Right now, I would say we are actively evaluating that question.
Thanks, Lisa. Next question comes from Celine Stevens with KGW. Go ahead, Celine.
Yes, hi. So my question is just who specifically in Oregon will be responsible for the decisions on these guidelines? And also, when can we expect to see these guidelines implemented? Like, when will this actually be in effect, and who's going to be making these decisions?
So our intent is, rather than conceiving of original guidance of our own, to align our recommendations and decisions with trusted medical experts and associations, including ACOG, the American Academy of Pediatrics, a number of other medical associations that are imminently to release additional guidance for adults. We will be making that decision at the agency leadership level in consultation with our respective governor's offices. Dean, would you like to add anything, Dr. Seilinger?
Sure. Thank you, Dr. Hathi. Good afternoon, everyone. I think, our collaboration across the West Coast is not new. We worked throughout the COVID pandemic together. The Western States Scientific Safety Review Committee was stepped up because we were worried about political interference in vaccine recommendations that didn't materialize. But now we're living in a world where that political interference and a move away from a basis in science has happened. So in order to reduce the confusion, the three states working together, looking towards independent science-based disease guidance, including vaccination recommendations, is what we have done before, and we will do it now. We will work in each respective state on steps we have to try and ensure coverage and assure access to vaccines. And those conversations have started already and have been ongoing and will continue as we try and address these access and payment issues so that everyone who wants a vaccine to protect themselves and their family in the fall will have access to it.
Are you able
That is
to,
our goal.
thank you. Are you able to address the second part to my question, which was just like the timeline? Like, when are we going to see something happen? Another notice, just when do we see things start?
Well, I will say for now, what we're saying is who should get vaccinated. We have some good evidence-based recommendations out of our professional organizations. The American Academy of Pediatrics looked at recent data that showed that kids under 2 have the second highest hospitalization rate after older people. And so they are vulnerable to complications from COVID. So we recommend that in accordance with the AAP recommendations that all children under 2, 6 months to 23 months, get vaccinated, and that children between 2 and 17 have access to that vaccine if they have underlying medical conditions, if they live in a congregate setting that puts them at higher risk, if they live with a family member who's at higher risk and their parent wants them to be protected. Every child should have access to that vaccine. Same thing with adults. Adults who want access to the vaccine should have access to that vaccine. And we have recommendations from our professional societies from last year and expect, as Dr. Hathi said, updated recommendations soon on that we can point to for the current season respiratory vaccine. The American College of Obstetricians and Gynecologists know that pregnant women, are more vulnerable to complications from COVID, and that their babies after they're born are more vulnerable to complications from COVID. So they recommend that all women who are pregnant receive the COVID vaccine, and we stand by that recommendation. So some of those recommendations are here right now. Others will be coming over the next week or two. And as we get things in place to assure that payment and access to vaccines is available, we will announce that as it comes up because these conversations are happening all the time.
Thanks, Dean. And I would just add one point, which is that as perhaps unsatisfying as this response is, we are exploring, as I said, a menu of approaches together with California and Washington, learning from past experiences, as with COVID, learning from other states that have already stepped into the void here as well, and have issued standing orders, other statewide clinical pathways, insurance coverage, statutory protections. Again, there is a gamut of policy mechanisms that we could deploy here to achieve the underlying objective. California and Washington are each have their own statutory frameworks, each have their own timelines. California, for instance, their legislative session ends in 2 weeks. And so we may see differing timelines across the states, but the goal is collectively to move as quickly as possible, responsive to the recommendations from these trusted medical organizations that are very much still coming online, recognizing too the ACIP meeting that's going to transpire in the next 15 days. And so as soon as we can, but you may see some proposals rolled out in some states sooner rather than in others.
Okay, thanks, Celine. Appreciate it. Next question comes from Heather Roberts with Oregon Radio News Network. Go ahead, Heather.
Thank you. I'm just trying to understand, we're talking about insurance and we're talking about coverage, but then access is kind of a separate issue. And we've already heard reports there are some pharmacies saying that they just flat out aren't going to offer COVID vaccines to kids. Is there any discussion of the state providing vaccine clinics or to more than just the Oregon Health Plan members, to private insurance members who might not otherwise have access to a vaccine because their doctor or their pharmacy is just not going to give it to them?
Thanks for the question. I'm happy to start with this, and then I'll turn it to Dr. Seidlinger to make any additional comments. But again, we are exploring all possible avenues for expanding access and coverage of vaccines, including coordinated purchasing and access programs availing of existing resources and initiatives like the Vaccines for Children program, like the Vaccine Access Program in Oregon. There is infrastructure in place. We have prior experience. We know what works from the COVID-19 pandemic. And so, again, the goal here is, one, combat misinformation, two, ensure continued coverage of vaccines, and three, safeguard access more broadly, especially for our most vulnerable communities. And so access very much is part of that equation.
Thanks, Heather. Next question comes from Amelia Templeton with OPB. Go ahead, Amelia.
Yeah. Have you identified any funding for this effort? You just mentioned Vaccines for Children. That's heavily federally regulated and federally funded. If you had to, backfill purchasing vaccines, where would the money come from?
Thanks, Amelia, for that question. I think this is precisely the value of multi-state collaboratives like the West Coast Health Alliance. There are potentially bulk purchasing opportunities that we can further evaluate. We can pool our resources. And so while it is not my place to speak to necessarily new resources, we are looking to better leverage the existing resources that we have across all three states, as well as our negotiating authority and block as a coast.
There's talk of the states in the Northeast attempting something similar. Have you heard from any other states today that have expressed interest in also working with Oregon and Washington and California?
We are engaging closely with ASTHO, the Association of State and Territorial Health Officials, as well as the Northeast Collaborative of States that are working on a similar timeline to ensure continued access and coverage of vaccines. So we're very much in lockstep with national public health associations and other states on both sides of the aisle that are exploring how to protect health and ongoing vaccine access amid failures in federal leadership.
And timing-wise, is the idea here that everybody's anticipating changes coming out of the ACIP meeting later this month and trying to prepare for that?
What I would say to that, Amelia, is that the governor recognized, our states recognize the need for competent, science-driven, evidence-based leadership long ago, with the very first glimmers of incompetency and inconsistency at the federal level. And I think recent events, as well as the imminence of the upcoming ACIP meetings, have accelerated the timeline. But these conversations, born of prior successful experience during the COVID pandemic, we know what works. We've done this before. These conversations have accelerated, but they began a while ago.
Thanks, Amelia. Appreciate it. And with that, I think we'll wrap this up.